Today you can catch us on Facebook Live and also on this Zoom platform. I would like to take this opportunity to welcome all of you and a very good morning from wherever you are. Welcome our participants and our attendees from Singapore, Philippines, the Malaysians, and the other surrounding countries. Right? Again, welcome. I'm Lee Seng. I'm the Medical Director of the Central Region Trauma Services in Singapore. And today, it's my privilege to share this morning with all of you to talk about common scenarios that we may meet and see on the roads or at home in order to help as first responders. I believe strongly that the first responders play a very important role in the management of patients prior to our medical services coming, right? So, how are we going to do this today is that we'll have a live stream of cases or common scenarios, which are both incorrect and then followed by the correct method of doing it. And to guide us in this, we have specialists and subject matter experts from the hospitals and in Singapore, and also from our paramedic main paramedic group and first responder in Singapore, the Singapore Civil Defence Forces. And we'll be taking you through these scenarios one by one with a guest speakers and panelists to take us through the 3 scenarios today. Right. So without further ado, I'd like to jump into our first webinar scenario, and that is to focus on our cyclists. First and foremost, in Singapore, during the COVID, we realized that our COVID has also brought to us new ways of recreation, new ways of exercising, and cycling has taken a major role in this COVID pandemic in encouraging everybody to get out, but yet in a safe manner. And in addition, we also noticed that there are a lot of food delivery apps for which a lot of the fastest and easiest way would be that of delivering food via cycling, right? So our first scenario will focus on how a potential injury can happen to a cyclist on the road. Let's take us through our first scenario.
What happened to you? Can you sit up? Is it painful? Oh, okay. Sorry. Okay, I take out your helmet for you, okay? Sit up.
Oh.
Come. Sit up. Are you okay or not?
My left shoulder.
Your left shoulder? What happened to your left shoulder?
Hurt.
Okay. Now you sit up. Okay. How? You need to drink some water? Are you okay?
Okay. Cannot move properly.
Cannot move where?
My left shoulder.
Okay, so that was a very quick example of what potentially could have happened this morning to any of our cyclists, which we hope not, right? But nonetheless, we do have our panel of specialists here and subject matter experts. And today I'm very privileged to have Dr. Hing from the President of the Singapore Cycling Federation, who's here with us to share with us his insights as not just a doctor, but also a avid cyclist and the President of the Cycling Federation of Singapore. Good morning, Dr. Hing.
Good morning, Lishan. Thanks for the invitation.
And also we have our paramedic specialists from the Singapore Civil Defence Forces, who are our main first responders in any emergency situation in Singapore. And I would like to welcome Warren Kenneth Fong here to help us answer some questions and guide us on what we can do as first responders. Kenneth, good morning.
Hi, good morning. Thank you, Dr. Teo. I'll try my best.
Okay, I think all of us work very closely together. I mean, we have been colleagues and friends, but I think it's important for us at this moment in time to share with you our thoughts and how we can collaborate better and work together better as first responders, right? And if any of you have any, this is a live session, so any of you have any questions they would like to direct at any of our panelists here, please feel free to put it in our chat box, right? And we'll answer them in due time, and we'll try to answer everybody's questions. So my first question would be that to Dr. Hing. I hope this doesn't happen too often, but the car was going at quite speed and hitting the cyclist. What, as a first responder, I mean, when we cycle in a group, right, what would you advise us to do when we see such an unfortunate incident?
So if you're cycling in a group and something like this happens, I think, of course, the first thing you want to do is rush to the poor cyclist who has been knocked down. But I think very importantly, if you have a group of people, first you have to make sure that the accident site is pretty secure and nobody else is in danger. So what I would recommend is that for some of the cyclists who are present, to actually maybe create a roadblock further down the road, put some bicycles there with their lights blinking so that cars that are coming will not, crash into the people who are helping the victim, and you end up with more victims over there. And for the rest of the people who are there who can help, I think then that's the time where you really need to go and assess the poor patient who's on the floor.
Okay, so I hear that so when we cycle in a group, isn't it? So I guess it's safer. Would you advise us to cycle in a group given that this is what you recommend?
Yeah, I would recommend that when you go out, you should always cycle in a group, at least maybe 1 or 2 people. There's a few reasons for that. One of the main reasons is that if there's any accidents happening, or if something does happen, somebody else will be there to help you, and something can be done immediately. And also, when you cycle in a group, you're more visible to cars and to other road users. So when there are 2 or 3 cyclists, I think they are more obvious, and accidents can be prevented in that way as well.
Okay, so if let's say we have actually sort of cordoned off the area, right? I think Kenneth, when we have a cyclist, how often and what are the challenges when we have a cyclist who's injured on the road compared to other road users? Do you, in sense of a common roads or even on cycling paths, how do you get to them?
Yeah, so I guess Singapore is always developing. There's more new cycling trails that people will actually want to go and cycle. So I think one of the key challenges as a first responder from SCDF or any first responder, right, was to actually properly locate the location of the accident. Yeah, so because sometimes they may be cycling on a very long stretch. Example, a very famous cycling trail will be at the Changi Road. Yeah, the Changi Cross Road. So sometimes it's a very long stretch of road. There's not much major landmark, I would say. Yeah, it's just lampposts along the way, and next to it is the up and coming Terminal 4. Yeah, so there's not much landmark there. So I guess the key challenges that we have is actually to locate the accident itself.
Okay, so those are on our normal roads, isn't it? Yesterday Dr. Hing was sharing with me, everybody likes to cycle on roads that or trails that actually are quite scenic in Singapore. And there are some, thanks to him, now I feel like going to explore them. But what if I'm injured on one of those trails? What do I do? How do I even ask for help, especially if I happen to be alone or I'm just with another friend, right?
Yeah. So okay. So if in doubt, let's say just call 995. Just call for the emergency ambulance services. Because one, you can actually get quicker medical services to you fast. That's one. Then 2, if you're unsure, let's say you're not medically trained, let's say Dr. Hin is not with you when you're cycling, the 995 operator can actually give you advice, first aid advice. And I think if the ambulance can't find you, the ambulance crew can actually call you. So on my own ambulance practice, right, if I can't find wherever the cyclist or the accident is, you can actually call the caller and just to find you and probably just give us a better description because it's not a third-party person that you're talking to. You're speaking directly to the paramedics or the ambulance crew that's coming to you. Yeah. So I guess my advice to everybody is just call 995. It's okay. You don't have to worry whether is it severe or life-threatening or not life-threatening. At least we are there. We can actually properly give you proper medical advice and guidance.
I guess this is quite universal, isn't it? For our friends in Malaysia or Philippines in the region who are tuning in, this is quite universal in the sense that your own paramedic services would be able to advise you on the phone, and therefore carrying a phone is very important. So talking, I remember yesterday you were sharing that there are some personal stuff that we do need to bring along. But yeah, but before we jump into that, when we looked at the video, right? Talking what jumps out at you and what do you think we could have done better?
Okay, going back to the video in particular. So if you recall, the first thing that you should do is you go to the patient and make sure that the patient is breathing, right? And he's not bleeding. If there are obvious signs of bleeding as a hemorrhage, you should stop the hemorrhage. And then after that, look for the very, very basic signs of ABC. So check the airway. If the patient can talk to you, that is a very good sign. So he's conscious, he's alert, his airway is secure, and then he's also breathing. And then if the circulation is there as well, I think most of the danger is over. Then the next step you can do is assess the patient. I think that particular patient had a lot of pain in her shoulder. So you should try not to move the patient because you do not know which part is injured. When for shoulder injuries, you think of either a dislocated shoulder or there could be a collarbone fracture. So keeping the patient still will be quite good. And that's the point where I think you really need to call the ambulance service to come down. So when the ambulance service comes down, they can actually wrap the patient up, secure the fracture if there is one, and then move the patient more efficiently on the board.
Okay, so if my colleague or my fellow cyclist has a deformity while waiting for the paramedics to come, would you advise us to splint it or do something to it on the ground, or just wait for Kenneth to arrive in his flashing ambulance?
Okay, so I would say that it would be good not to move the patient unless the patient is in danger. If it's a very dangerous area and the patient needs to be moved, then try to get a few people to come and move the patient as a single block, right? So you make sure you secure his neck, try not to move the neck at all, move the neck together with the body, get a few people to actually carry him and move him very gently to the side of the road if he's in danger. But if you could secure the area with your friends in front, with some bicycles put across the road with the blinking lights, and with some people waving and marshalling the traffic, then it's better really not to move the patient.
Yeah, so I think the key take-home message would be that of trying to secure the area, right? Prevent further injuries to your other cyclists, and to alert fellow road users that there has been something that has occurred and we need them to stay clear, right? I think that is very important to prevent further injuries. I mean, from a trauma surgical point of view, I only want one victim. I don't want multiple victims, right? In that sense, from that. So I think that's really important. And I noticed that the way that cyclist was wearing a helmet, how would you advise us? Should we remove the helmet? Because that's my reflex as a layman, right? Oh, you're on the ground. I want to wake you, I want to decrease the discomfort. What would both of you advise us to do? Kenneth?
Actually, I would rather the helmet be on. Why? I mean, in the event the helmet there's some bleeding at the head, right? The helmet actually acts as a pressure point to actually tampen out the bleeding before it comes out. Unless there's some, let's say, what's on there's an impaled object there, yeah. Then or there's something that's inhibiting the mouth for the patient from breathing. Yes, then we have to remove it. Example, like if the strap is too tight, then it's actually strangling the cyclist. Yeah, then maybe we would want to remove it. But I mean, if everything is all quite stable and the guy is just unfortunately he's just waiting for the ambulance to arrive, I can just leave the helmet on. It is not a must, but it's very subjected to whatever injuries the cyclists actually have.
Dr. Hing, what do you think?
I think that's a very good idea. I will leave the helmet on as well.
Yeah, I think the strap sometimes can actually cause a bit of discomfort. So I think maybe keeping the helmet on, just loosening the strap if you need to, but then that loses the tamponade effect, isn't it?
Yeah, that is. So I mean, different people would have different how they want to tighten it. Sometimes they want it loose, slightly looser. Sometimes they want it very tight so that they protect the head. So different people have different tastes to how tight they want it to be. Yeah, so we don't detect that, but I mean, I guess the principle behind it is still, if there's no life-threatening injuries that you don't need to remove the helmet, all right, then there's no need, because then again, the principle is if there's a bleeding there, then the helmet will actually act as a pressure point for the bleeding spot.
Yeah, and from a trauma surgeon point of view, whether the helmet was intact or whether the helmet flew off, from where I sit as a trauma surgeon, that was very important information for me, whether or not significant head injury has occurred. And still on the idea of head injuries and helmets, maybe Dr. Ying can share with us. Kenneth mentioned about everybody has their own way of wearing a helmet. Number one, what do we need to take note of and wearing a helmet? Because it seems, in your experience, are helmets that important in managing or preventing injuries? Okay.
From the point of view of Singapore Cycling Federation, in association with traffic police and all the other agencies, please wear a helmet when you cycle. I have a helmet here. Actually, I'm on the way to a ride. I think helmets, there's no data or that proves that helmets do not save lives. And in the event where you do have a crash and you do fall, there's a very high possibility. Yesterday in our talk, we said that there's a very high possibility that you hit your head, because when you're cycling, very often when there's an accident, it's always something that hits the front wheel. And when the front wheel stops and you're going at 30 kilometers per hour, you're going to fly off the bike over the handlebar. And the first thing that will hit the floor is going to be your arms, your shoulder, your face, and your head. I would say that a full face helmet would be great, but nobody that actually wears that because it's not practical. But very often when you hit your head on the floor, your skull will take the brunt of the impact. And the bone is very thin, and a lot of things under that is very, very precious. So I would say that, you know, a helmet will have a lot of designs inside. I think there are lots of tests that our helmets in Singapore go through. If you buy a helmet from a reputable shop, they have gone through lots of different safety standards, whether it's Asian or European. There'll be crush zones, there'll be rotational protection. So that will at least reduce the impact. Like Dr. Alishan said yesterday, it may not prevent 100% of, you know, damage to your brain or to your skull, but it can actually definitely save a lot of potential injuries that you can have.
Kenneth, with regards to helmets, any advice if I have a cracked helmet, do I leave? So basically just leave the helmet on at all times if you have a victim.
Again, depending, it's really based by whatever injuries or whatever is required to do all the critical interventions that need to be done. But I guess I think the take-home message is still don't just put the helmet aside. If you happen to just take it out or you just got flunked out, don't just keep it one side and just ignore it. It tells us a very good story, especially like if I happen to send the patient to Dr. Teo. So once I show him a cracked helmet, I'm pretty sure we would be jumping up and down because it actually tells us a lot of story on how severely damaged or the potential injuries that it can actually be transferred to the patient, especially the head. So that's why don't just keep a helmet aside. I mean, regardless whether a cyclist or motorcyclist or whatever helmet you're wearing, just show the helmet to the first responder. I mean, as a first responder yourself, you can always just bring it to the hospital and you can actually show the helmet severity, how damaged is it to the hospital as well.
Okay, so there's a question still on the helmets, right?
Yep.
There's a question from one of our attendees asking, how do we assess whether a helmet is roadworthy or is safe to use again?
Yeah. So helmets generally have a shelf life as well. I think they're like shoes that you buy. When the helmet is old, similarly, like if you buy a shoe that's 3 or 4 years old, it may not be as good. So for example, you buy an old shoe and you go for 2 or 3 walks, you may find that the sole actually drops off. So similarly with helmets, I think there's a shelf life. Usually it's about 3 years to 4 years. So however, if you do have an accident on a helmet, so I would say if you actually fall and you do feel that you hit your head on the floor, even when you look at the helmet and you may not see a crack on it, it would be a good idea to just buy a new helmet because, you know, you can't see whether there's any internal cracks already that have really happened.
Yeah, I think that's very important to note when our helmets are back to being so-called roadworthy. I think most important, always have a helmet on, right? And the next key takeaway is to make sure you have the appropriate helmet and the helmet is actually in good condition, right? I mean, some of us, I know it's not recommended, but some pass our helmets around, hand-me-down sort of thing.
10-year-old helmet. Yeah.
Yeah, so we probably should check it, right? And one of the other questions that has surfaced was that as a bystander or a layman, how do we now worry about the cervical spine? Is cervical spine a major issue? How do we protect it? Either one of you want to take that question?
Okay, maybe I'll just
spine expert.
no, not at all. But I mean, for us, I mean, the principle for everybody, if they are actually worried for a cervical spine injury, is actually just not move the patient at all. Yeah, so I mean, wherever the patient, I don't think you will get a very nice cyclist that will be in a very nice supine manner. It could be in any position that they will feel that is comfortable after the crash. Just leave them there. Just don't touch the head. Just let them lie down. Because if you're in a comfort position of comfort, right, usually they will tend not to move a lot. So just let them lie there. I mean, if you have extra pair of hands, you can actually just hold on to the head to actually minimize movement. Yeah, so that will actually help for first aid for cervical spine immobilization, that is actually a great help for any first responder that's attending to them already. Just hold the head, just minimize movement of the head. That will actually help a lot.
Well, I guess that's if we see someone on the road, but if we are alone, how much do we move? Just leave them in a safe position, I guess. And that's the take home message. Don't move them too much. If they are comfortable, although they may be groaning and we can be visually stunning that there's some blood and bruises, but I think until the paramedics come by or until you have enough manpower or people who can safely move the patient to the side or road path, then we should. But otherwise, I think if you are alone, I think the best thing to do is to call for help, right? And to signal the other cyclists to be careful and other road users to be careful. I can imagine on a park connector at night, I mean, lots of people may be cycling and not seeing the injury itself. But how do we now make ourselves more visible on our park connectors and especially in the evenings where everybody likes to cycle? In Singapore, it's very warm to cycle in the day. So we tend to cycle during the early hours or in the wee hours where light may not be that great. So maybe Dr. Hing can share with us how do we protect ourselves and in the same time protect the people that the victims that we are trying to respond to.
So generally, if you're out cycling, be it during the day or the night, nowadays the recommendation is that you should wear something that's brightly colored. Maybe avoid colors like black. I know it's a very in color, but yeah, sometimes the more obvious colors are like white or luminous yellow. Those make you more obvious, and especially in the night. Even during the day, you should also have lights, front and back lights. Generally, even for myself, when I cycle during the day, I do switch on my front and back light. And nowadays, we also have cameras as well. So if you heard of cameras, put them on your bicycle as well, because I think they're very, very useful to record, any interactions between you and cars if there are potential accidents. So on the park connectors, we know that there's some parts it can be very, very dark. So having a good light is important. And when accidents happen, and unfortunately they do, make sure that your lights are on to warn other people who are cycling along the path so that they do not hit you and you end up with more victims.
Okay, so I think lighting and equipment and making yourself visible are important, right? So I think in terms of being a first responder, right? If would you advise any of us, let's say in the park connector, while waiting for the paramedics to come, would you advise us to move them to somewhere is closer? Intuitively, if we are somewhere in the middle of the Punggol Park connector, right, cross island park connector, how would you advise us to try to move the patient to somewhere that's more accessible to you, or just wait it out? Okay.
Again, depending on where you are at, I would say the best advice for us to reach you or any cyclist in the middle of a forest or park connector would be just wait for us. Just wait for instructions by your emergency operators. Because how it happens is if you're lost, we don't know, because usually the first few minutes we are trying to make a picture on where you are. So if we can't reach let's say we can't reach the cyclist or the patient per se, we will just try to tell them to move or to backtrack a little bit so that at least you get some landmarks that we know we can actually go to or to make it easier for you to reach. But I mean, for the first few minutes, just stay where you are. Most of the time, we should be able to reach you. However, for whatsoever circumstances that we can't reach you and we require your assistance, then during that time, there will be some instructions from the emergency operators to actually tell you, maybe you can just, do you remember how many minutes ago do you saw, let's say a lamppost or a shelter, or if the shelter has any wordings onto it, probably you can go there so it's easier for us. Or example would be if you are in danger. If you are in danger, let's say maybe you are in, maybe you're in a monsoon, now we're in a monsoon season, and it's raining severely, or maybe you're afraid for falling branches if you're in the middle of the park connectors, yes, then probably we will advise you to actually go to those places. But my first advice is always to actually just stay put, just wait for instructions from the emergency responders.
Yeah, so one of the questions was WhatsApp can send location tracking in that sense. How does that work? I mean, we could send it to our friends where we are, but will that work in an emergency situation?
I'm not so sure about WhatsApp, but I mean, there are apps available. I'm not so sure about the overseas counterparts, but I mean locally, we do have apps that is available for member of public to actually download. And those apps, example, in Singapore, we have this app from SCDF called My Responder app. And those app is actually linked to our mobiles, I mean our location. All right, or so that we can actually link and know where you are. Yeah, so at least the responders and the op centers will actually get your live feed on where actually you are. Yeah, so those are useful apps that you have. But again, different countries have different apps that's available. Yeah, so I guess not all WhatsApp will be available in all the other countries as well.
Yeah, so I guess inherent to your own country, we have to look at your own tracking options that you have in the country, right? So one of my questions that I always was thinking, right, Dr. Hing, it's quite common for me to crash and end up in a ditch, right? Then after I pick myself up and continue on my way, right? Is that safe? Or should I actually just wait it out and be the chicken person that I am and call for help?
I think that's a great question that we must address. We know that crashes are common. So when can you get up and continue cycling? There are times when you shouldn't, and there are times when you still should be able to continue cycling. So let's say you're cycling along, you just had a fall. When can you continue cycling? So if you fell and you did hit your head and you do feel a bit fuzzy, so you have some head injury, you may have a mild concussion. I mean, sometimes the first instinct with all your friends is that you want to continue cycling with them, you want to jump back on. Somehow cyclists have this very macho mentality when they watch all the races and people just jump back on with bleeding arms and legs and they continue cycling. There are times when you should never do that. So if you're feeling a little unwell, feeling a little fuzzy, like maybe you had a glass of wine or 2 glasses of wine, I think you should never get back onto your bicycle and cycle. It could be dangerous. Or if you start cycling and you feel some pain, maybe in your hip or maybe feel some pain in your knee, before you do more damage and it takes you out for a whole season, I think you should also get off the road. Nowadays, there are lots of Grabs. You can call a cab, you can call your wife, or you can call your husband and they'll come and pick you, I'm sure. The other thing that you should check also is your bicycle. Make sure that it's still roadworthy. Sometimes you may not notice the derailleur may be loose or may be broken, or your wheel may have a loose spoke. You may get onto the bicycle, cycle a certain distance, and the mechanical causes you to have a bigger accident, like if the derailleur goes into your back wheel, and then you will have a really severe fall again. So that's also times when you should not get back onto your bicycle to cycle.
I think one of the things is that we forget is that other than our personal roadworthiness is our bike, isn't it? Whether or not later on, as we are coming downhill later, we may actually lose control of it because of mechanical issues. And that itself may be even more severe than the initial injury. So do take note on your rides today, right? And this evening over the weekend, school holidays are coming, right? As we take our kids out for a ride, these are the things that we need to know, right? And I hope we can keep our shared paths on our park connectors, our roads, and have equal responsibility in stopping and helping, learning from Kenneth and Dr. Hing what to do as we go about our daily lives and our weekends, right? Let's have a recap of now what our first responder did just now, and let's see from what we have just shared, what could we have done better, and then let's have a look.
What happened to you? Can you sit up? Is it painful? Oh, okay. Sorry. Can I take out your helmet for you, okay? Sit up. Come. Sit up. Are you okay or not?
My left shoulder
Your left shoulder? What happened to your left shoulder?
hurts.
Okay. Now you sit up. Okay. How? You need to drink some water. Are you okay?
Okay. Cannot move properly.
Cannot move where?
My left shoulder.
What happened? Are you okay? Okay. First, okay, let me see. Can I just make you more comfortable? Don't move. I try and remove your helmet for you. Okay, you don't move yourself. Yeah, don't move. Don't. Just relax. Okay. Okay, anywhere else very painful? Don't move your head, okay?
My left shoulder.
Your left shoulder.
Yeah.
It looks a bit jialat, Okay, let's not move this. Just put your hand down slowly. Okay. Don't move your head. Just put your leg down. Comfortable. Make yourself comfortable. Lie slowly. Anywhere else is painful? Your tummy is painful. Oh, okay. I'll call for help, but you don't move, okay? Hello? Is this SCDF? Yeah, I have a friend, she fell from the bike. Can you all come over to us? I think she has some abdominal injury. Yeah. Okay, can. Thanks. Bye. I'm just going to wash your wound a little bit. Okay? Maybe a bit painful, just bear with me, okay? While we are waiting for the ambulance to come. Okay, Oh, your hair look like there's quite a bit of deformity. Is it very painful?
Yes.
Okay, maybe there's a fracture, so you don't move so much, okay? Don't move, Let me just try and do some stabilizing for you.
Okay, so we've seen what could have been done and what a very qualified first responder would be able to do and seen, and the various innovative ways that we can do. I think the take-home message is number one, to minimize movement of the patient. And as we mentioned earlier in the focus, that the helmets, unless you're very confident or unless the patient is really, really in distress, we should keep the helmet on. After reviewing what the last two videos, any closing words from Dr. Hing and Kenneth?
Well, I hope to learn more as well. Every day is a learning journey.
So Kenneth, I think we will have you on for the next few sessions, right?
Yeah, definitely.
So thank you, Dr. Hing. Thanks for taking time off your usual Saturday rides and guiding the rest of your Singapore Cycling Federation in safe riding. And we hope to see you socially and not in the emergency departments anytime soon, right? Same thing with Kenneth, right? So nonetheless, thank you both for joining us, and do stay with us for the next segment, which is that of home injuries from falls at home, right? So the next segment would focus on child injuries, and the common injuries that we happen to see at home would be that of falls in children, right? And that would also constitute a lot of queries that we have had from the public with regards to what to do when I have a child who is at home and who has fallen off a bed or has been climbing, and our children are all very inquisitive these days. And what do we do when these things happen? Maybe I can show you a typical scenario of a young boy at home and what he did and what did his parents do. Can I show the video, please? Okay, hi. So that was a very short clip of something that has happened to me before when I was a kid. During my time in the 1980s, we had these bunk beds that were super hot, and I asked my mom for a bunk bed, and my sister and I would push each other. Stop reminiscing about the past and come to the present. Today we have Prof. Tam, who's a senior consultant for emergency physician from the Children's and Emergency Hospital, Children's and Women's Hospital in Singapore, right? And again, we have Kenneth here, right, who is here to again provide first responder advice and insights to our family members and our caregivers at home, who may not be us, but maybe anybody who's at home at the point in time of the incident. Again, thanks Dr. Tam for taking time time on a Saturday. I'm sure that you've been very busy at the Children's Emergency, one of the busiest in Singapore.
Yeah. Good morning, everyone. Thanks, Li Shen, for the kind introduction. It's a pleasure for me to be on this show.
So, Doctor, how often do you see this? I mean, it happened to me. I fell a few times and I'm still here, right? But nonetheless, how often do you see this at in your Children's Emergency, and how do you advise us to now take care of these as a first responder at home?
Yeah, so in our Children's Emergency, injuries for children coming to our emergency is actually quite common. It takes up about 17% of our attendance. And if we look at all these children who are injured, half of them easily are from home injuries actually. And if we look at of those children with home injury, half of them actually arises from falls as a mechanism. So of course falls, the most common one would be slip, fell, trip, fell, and hit onto like furnitures and all that. But fall from height is also something that we see. And if it happens, then we are always worried whether there is any serious injury. So when we say fall from height in children, right, we're talking about 3 times of their body height. So because if we talk about infant versus teenager, then definitely the degree of the height of fall will come into consideration. So of course in the adults we talk about 3 meters and above as a serious mechanism of falls. So one of the first thing is when they fall from height, even though this is like from a ladder up to the bunk bed, for a young kid it can be actually quite high. So one of the common injuries, right, when they fall from height is definitely head injury. Head injury, we see it quite commonly, easily like 60% of the time when they fall from height. The reason also partly because they are actually proportionally bigger in the head. So when they fall, actually very often one of the first body part that hits the ground is actually the head itself. The other injuries are definitely limb injuries. So they can break their fall with their arms, and so they get fractures in the forearm, fractures and contusions in the limbs, cuts in the face, bruises over the limbs as well. So these are some of the common injury. Cervical spine injury is definitely something that we always want to look out for, though it's not common. But if it does happen, it's really something that is very serious.
Back to the video, right? As a first responder, it really reflects action when I see my kid fall and then start doing what our parent did then. Is there anything you'd advise us to do any differently if you were in the same scenario?
Definitely. So when the child falls from a height like this, right? So the first thing is when you go there, don't panic because the first thing is when you see their child fall, parents actually panic. I mean, that is just normal human behavior, but stay calm and then don't shake the child violently because as we mentioned earlier on, though cervical spine injury is not so common, but if it's there, then it's something that's very serious and potentially it can actually cause paralysis and all that. So then what we could do is that when we approach the child, gently tap on the shoulder, call out to him or her, and ask him or her whether they are all right. So if they are all right, then they will tell you, oh yeah. Of course, very often they will cry. So when they are crying, then you know that they are conscious. Yeah, but if you go there and then you see that they are actually drowsy, or they are unconscious, or they may even start having seizure, then these are all red flags. The other thing is also look out for any weakness in the limbs, any bleeding from the nose, from the ear, then that would indicate red flags that there is actually intracranial hemorrhage or something serious, bleeding in the brain, fracture in the brain, in a skull itself. The other signs of head injury are actually vomiting. So sometimes all these symptoms may occur over 24 to 72 hours. So you need to monitor the child over this time period. And headache and giddiness are also some of the signs and symptoms.
Okay, so latching on that, in terms of you were mentioning that the signs of head injury may actually evolve, right, or may develop throughout the day, right? So are there any subtle signs that would make you advise us to be worried? That's one. Number 2, and how long should I wait before I bring them to you for help?
Yeah, so the thing is that, like in the situation just now, after they landed on the ground, right, and if you find that the child is drowsy, unconscious, having a seizure, unable to respond, any weakness, then immediately you should actually call the ambulance and then that should actually bring them to the emergency department. But other than that, say if the child is able to respond to you and you ask the child, is there any pain anywhere, and there's no pain, then in that case, then you may be able to monitor the child over the next 24 to 72 hours for the symptoms that I was mentioning just now. So the headache, nausea, giddiness, vomiting. Of course, the drowsiness sometimes can happen gradually, especially if it's like a small bleed that initially may not have very obvious symptoms, but generally most of the time over 24 hours they should manifest.
Okay, so now that I need to call for help, right? So maybe I can ask Kenneth, right? How would you advise us, as an anxious parent or caregiver, or even our domestic help at home, right, who now encounter this, right? What are the information that you need, right? And how would it help you to get to us a bit faster and more accurately?
So vital informations at scene would be definitely how high the kid has fallen, or whether there was an episode of unconscious or seizure. So those are things and important key signs that we will want to actually know. And we also want to translate those information to the hospital. So if the first responder actually reaches there, and those are information that you have actually given us, we can actually decide and actually pick up those critical information, and if need to, we can actually call in the receiving hospital or pediatric hospital to actually get ready and get ready a bed, and those and get ready a bed, and the medical team to be waiting to receive that group of patients lah. So again, don't panic. Give us the important informations, or just paint us what happened to the incident, so that at least we can be the one that is telling the doctors and quicken the medical response for the kid.
So one of the questions that when I was chatting with my friends the other day about this session was they were asking me, so when do I know I should call SCDF, or when should I bring my kid to the nearest pediatrician or nearest family physician for assessment? What would you advise in a simple fall? Because most of our children just fall and then they get up and just run around and as if nothing has happened, right? So where should we go, right?
Yeah, so as I was sharing just now, so if the child upon the fall, right, and you reach there and then you gently tap on the child and the child is not able to respond to you or look very drowsy, worse still if there is a seizure, then these are immediate red flags. You must call 995. Or at the same time, if he's able to respond to you and you find that there is any weakness in the limbs, or there is any bleeding from the ear, from the nose, then that is a sign that there may be some important serious intracranial bleed. Then in that case, you should also call 995.
So
Or the other thing is also spinal injury, though it's actually not so common, but if the child is actually having pain in the neck, the back, then you shouldn't move the child, bring the child to ED yourself, but you should call for the ambulance.
so I don't carry my kid into my car and just rush there because thinking that Kenneth's team will come a bit later than me rushing there myself.
No, the reason being that the emergency response is very timely in Singapore, and they are trained to actually resuscitate even on scene. So especially if the child is drowsy and if there is a seizure, then very often they may actually need to provide emergency interventions, and that can be actually provided even at scene in the home itself, rather than trying to rush to bring the child in your own vehicle. We have received cases like this before, and it's easily a delay of 10, 15, 20 minutes on the way here.
Okay, so Kenneth, I think that's the take-home message we want to send to the parents and fellow caregivers out there, that much as we are very anxious and really in a very bad situation at a point in time, keep calm, trust our paramedics to come to you. And sometimes when we are, as a parent, when we are rushing and driving our kid to the children's emergency, our emotions can get the better of us and we may actually get involved in an accident ourselves, right? So that don't put ourselves in greater danger, because then that also will not help your kid. Furthermore, en route to the hospital, if your kid needs medical attention, it's really very challenging for the medical teams to then get to you while you're moving. I think that's something that we need to know, and I think keep calm, right, and then let our medics come to you and provide you further assistance, right. So part of that video also showed that the patient had some, or the victim had some abrasions or some skin injuries, right. And I saw this little orange colored powder. What type of powder do we usually put in this?
Yeah, so when they fall from height, or even if it's not fall from height, it can be trip and fall. If they hit onto, because the children's skin is actually quite delicate, so if they hit onto some corners of furniture and all that, that can actually cause laceration or cuts. So when there are cuts, right, so the first thing is, if the cut is actually superficial and it's not really bleeding, then you can actually wash the wound under running water, and then after that dry the wound with clean gauze, and then after that you can apply a clean dressing over it. But if the wound is bleeding, then in that case you need to stop the bleeding first. So get a clean gauze again and then press over the wound itself. Sometimes you may have to press for like 5 to 10 minutes in order to stop the bleeding. And then once the bleeding has stopped, then in that case you can see how deep is the wound, whether the wound needs to be stitched, or what we call suturing, or sometimes we can even use tissue glue to glue up the wound at certain areas if it's actually not so deep, but yet it's not good to leave it alone. So if there is a cut, unless it's very superficial, then you should bring to the emergency department, or at least to a medical professional to assess. So the thing is that powder, ointment, cream, toothpaste, all these are something that sometimes we see caregivers apply, hoping that the bleeding will stop. Some traditional powder may have this myth that it has anti-inflammatory properties and all that. It's a bit hard to tell, but the problem is that all this can actually cause contamination of the wound. So we will not encourage putting powders and ointment unless it's antiseptic ointment. Then that would be acceptable.
Okay, so in the immediate response, if I have some antibiotic ointment at home, I can put that while waiting for Kenneth's team to come in. Is that your sharing?
I think it's okay. After you
Okay.
clean the wound, and if there's any bleeding, you stop the bleeding, and then if there is no more bleeding, you can apply the antibiotic ointment, or you can actually just cover the wound with a clean gauze. If it's actually a very superficial wound, right, you may not actually need to call the ambulance. You can actually bring the child to either the emergency department or the GP. They can have a look at the wound and see whether the child needs to go to the emergency department.
Okay. So Kenneth, you mentioned when the kid falls from height, one of the earlier things you mentioned was that to estimate the fall and estimate the height itself, how does that impact on your management or your, as you are going to the victim, in a sense? Because many times I would not be able to know how high he fell, right? Short of him falling off a certain height out the window, in that sense, right? So how would that guide you in your preparation for the patient?
I would guess that would actually so I guess that would actually indicates to us that we have to actually minimize the movement of the head, spine. Yeah, so I mean, wherever you are, whether you are a member of public or whether you are a first responder or a healthcare profession, I mean, once the information of us knowing that it's a fall from height of a significant height, we will tend to have certain maneuvers to actually minimize the movement of the head. Or maybe we need to put on certain tools, cervical collar, or maybe a hard backboard or a scoop to actually minimize or to support the spine, so that when we actually move the patient, there won't be much movement and we won't actually damage the spine even more. So that is just an indication for us, because usually what we will tend to do is like what you've seen in the video, right? When you don't know any history, you just tend to move the patient freely. Yeah, it's also easier for us to move the patient and in a more comfortable manner as well. Yeah, so I guess with that information, whoever you are, it's just a key indicator to tell us, hey, just stop. Maybe we just need to just minimize the movement of the head, that's all.
I see. So like Dr. Tam mentioned, the cervical spine injuries have been quite rare, right? Although as a child, we would also be worried about that, right? And the other if my child is running around throughout the day, does it mean that he's well after a fall? I mean, and if he is unwell, we probably need to bring him to a physician to be seen, right? In that sense. So, other than the fall and the bleeding and anything else, I think one of the things that was taught to me when I was in med school was a fretful kid. In that sense, what's that fretful kid all about? In that sense, yeah.
So young children themselves, right, is maybe a bit difficult to see whether they are sort of like having pain anywhere. But usually when they have any pain, right, they will start crying. So when they are infant, right, irritability will be one of the signs that they are unwell. So the unwell can be due to pain or due to even like a bleeding in the brain because they are having severe headache, but they cannot say so. So they will actually manifest it as crying and fretfulness. So if after a fall, if the mechanism is not something that's serious, so that means it's not like fall from a height. Say the kid was walking and then just lost the balance and hit something just close to the kid, and there is no very obvious injury, and subsequently after that the child is able to eat, play and continue to do the things that he or she can do. So then in that case, usually it's alright and you can continue to monitor. But of course, if after the injury, right, and you can see some obvious swelling, redness, the child is not willing to move that particular part, or when you touch it, they start crying, then that can indicate that there is actually some form of injury. It can be something that is simple, like just a bruise, what we call soft tissue injury, but it can also be fractures. And the more serious one, of course, it can be actually injuries, internal injuries inside the abdomen or the chest. This can actually come from like a more significant mechanism of injury, like a fall from a height.
So I think all these are good because good information that we would like to understand from a home perspective, right? And sometimes we are not always at home. Our domestic helpers and our grandparents are helping us care for the patient. So again, these are all a reaction to what has happened, isn't it? They fall. And how would you advise our friends and family to make our environment safer for the various age groups that we may see at home?
I think prevention, as I mean the old adage says, is always better than cure. So injury prevention is something that is actually very crucial in part of pediatric care. So in the home itself, definitely there are things that you can try to do to child-proof your home. So one of the most worrying thing is because many of us are actually staying in multi-level homes or flats and basically high-rise buildings. So it's very important that all the windows should have grills and make sure that the grills are locked at all times. We have a few cases that over the years have actually sustained fatal falls. So these are totally preventable. So the other thing is when they are very young, especially if they are less than 10, depending on the maturity of the kid, they should not be left alone at home. So many of these fatal injury or even serious injury happen when they are actually left alone, be it like playing with fire, so to speak, and they fell off from the windows. So the other thing is for windows, right, it's also important not to place furniture near there because they can actually climb onto the window through all this furniture that helps them gain that height that they don't have. Besides that, the other thing is also for bathrooms, right? It's good to close the doors and also make sure that there is no pails of water and all that because they can also slip and fall inside the bathroom. Try to make the bathroom empty slip, so and not to have pails of water around there. And the floor itself, when you have young children, they all like to run around in the home, so keep it uncluttered. So not like many breakable furnitures like vase, glass, panels and all that around, because all these can actually potentially break and cause injuries as well. and corner guards for the furniture as well. Yeah.
Yeah, the corner guards are quite inexpensive. Recently I went to a certain place and it was like $1 for 4 of them, and it's quite straightforward. I think these are things that we can do to prevent. I recently, unfortunately, had one. I think staircases are really very
Yes.
dangerous in that sense.
Correct. Yeah. So if they are living in multi-level homes, right, very important to have a safety gate at the stairs.
Yeah, so safety gates to prevent them from, number one, going down on their own, rolling down if they decide to come down a bit faster, right? Then there will be a bit of a tragedy to a certain extent. And there was an unfortunate incident that happened that I had to attend to. The child was looking over the staircase railing to call for his parent, and leaned over too much and fell from the 3rd story through the stairwell all the way down. So that was quite traumatic for the family.
Yes.
Yeah, so be very careful, right? The home, although we say should be the safest place, there are a lot of hidden areas of injury, potential injury that we could actually be quite treacherous for the young kids, isn't it? Right. So I think Dr. Tam and Kenneth have shared with us their insights on how to make our homes safer, right? And it should be a safe haven for our children. And we also now would equip ourselves and our caregivers, even our domestic help, with how we can avoid injury, and if that happens, how do we now respond to them, right? Let's look at the video, revisit that little snippet again, and let's see what, after what Dr. Tam and Kenneth have shared with us, what could he have done better, and how should we do it. Can we play a video, please?
This 995. Please come and have my choice as well. There's a lot of blood. Please come now. Thank you.
Great. I think we saw what should have been done and what could have been done, and a lot of us have small little first aid kits at home, right? And I think that would really help. Last minute, before I asked Dr. Tam for her closing comments and advice, question came in, is an X-ray necessary after a fall, Dr. Tam?
Yes, yeah. So the thing is that for X-rays, right, it will be decided by the medical professional, the doctor. So if the mechanism of the injury is something that's significant, like fall from height, right, and especially if we can see that there is definite pain and swelling of a particular area, then yes, we will need to do an X-ray and see if there is any fracture. But for skull X-ray, right, it's not routinely done unless what we call the hematoma, that means the swelling due to the blood clot under the skin, is huge. And in cases whereby there is actually drowsiness or there is actually change in the conscious level, right, then very often we will need to do a CT scan because that will tell us whether there is any bleeding inside the brain rather than just a skull fracture alone, because the X-ray can only tell us whether there is a fracture, but it doesn't tell us whether there is any bleeding inside the brain itself. So I would say that it's not necessary all the time, but if it's involving the limbs and there is swelling and pain, then in that case, X-rays will be useful to see whether there's any fractures and dislocations.
Yeah, I think X-rays would give us an idea of what needs to be treated and how we should treat it. But as a first responder, I think is to immobilize that limb not to give more injury that has already happened, and to immobilize it well, right? One of the comments on the chat was that after viewing the video, the caller doing what a parent would usually do, assume that Kenneth knows where I am, and just can you please come, and hung up, right? So Kenneth, how do you now manage these type of situations? Do you call back?
Yeah, so I mean, for whatever first responder, which country you are, I mean, location is always the main concerns for any first responder. So I guess as a parent, we will be definitely worried. I'm a parent myself. So a very simple way is to actually just follow the instructions for your emergency service operator. They will usually guide you. In the event they don't happen to gather the important facts, right, they will actually call back. Sometimes, I mean, locally in Singapore, we have a mandate that we actually call the caller just to verify the location, because sometimes, you know, they may have given the wrong location, and in the urgent midst of the kanchongness, they will just quickly put down the phone and maybe give the wrong location, or maybe I give my own location, but it's not where the exact location is. Yeah, so it did happen before, even to myself. So I guess the best advice for everybody is just stay calm. I know it's very difficult, however, stay calm and just follow the instructions of the operator or the paramedics that actually call you, or the first responder that actually call you to verify the location. We are here to help. We're definitely here to help, because we ourselves also want to be there as quick as possible and to the right place and to the right patient.
Yeah, so I think it's important. I mean, it is understandable, right? So take a step back, breathe, and then the first responder, wherever you are, emergency number you call, will be there to actually walk you through. We are used to this, right? And just take your time, take a breath, right? That few minutes you spend giving us the relevant information, the accurate location, actually buys us a lot more time than later us trying to figure out where you are and trying to help locate the patient, right? I think we are running a bit out of time, but I would like to invite Prof. Tam to share with us some takeaway messages that she has for all of us caregivers and parents at home.
Yeah, so I mean, as we mentioned just now, prevention is better than care. So childproof your home to reduce the risk of injury. And I think it's good for caregivers to learn actually first aid as well, so that you can provide some initial first aid measures and know what are the right things to do. And CPR is also important.
So Kenneth, any closing on these pediatric injuries that you have come across over the years? Any advice, any nuggets of information?
Again, I know it's very difficult, even if I'm the parent. I think the take-home message as a first responder to parents is just stay calm. We are here to help wherever you are. We are here to help. We want to come as fast as possible. So we may have asked a lot of questions along the way when we speak to you via the phone, but we are here to help, and we are here to actually give you the proper advice. So if you're unsure what to do, just follow, like what Dr. Teo have mentioned, just follow whatever instructions or whatever questions that we ask, so that at least it paints a better picture for us, and we can actually give you the right advice and the right tool for you to treat your kid or the patient even before we have arrived.
Great. So again, I would like to thank Prof. Tam and Kenneth for being here with us today on a Saturday morning. I think I've learned a lot from both of you, and childproofing my home is something that I never really thought about, right? We're assuming that it's always safe. So nonetheless, I would like to thank both of them for taking their time, and thanks to Prof. Tam for taking her time to come here. And I would now like to move on to say thank you and goodbye to Dr. Tam for now, right? And hope to see her socially and not in the emergency department at any point in time, right? And Kenneth, I hope you'll still stay with me for the rest of the panel discussion.
Definitely.
Okay, Ken. So thank you, right? Let's move on to the next segment, right? The next segment will be that of the other common injury or common scenario that we see on our Singapore roads, and I'm sure it's not unique to Singapore roads, and that is of a road traffic accident. I know that in certain countries we may call it a motor vehicular crash, but essentially it's the same thing that we would like to highlight. When we have a motor vehicular crash, what do we do, right? And if we are the first responder and we see such an incident on the roads that we are traveling on, what are our options? How do we even now provide care while waiting for Kenneth's group to come in to give us a hand with the patient? So these are the questions that we would like to share with you guys and in the public, because you are very important as first responders, because what you do will potentially make a difference even before our paramedics arrive. So to lead us on to the next session, I would like to show you a short video clip that the team has prepared for you, such that we can lead on to that. Can we show the clip, please? Okay, wow, that was quite a accident that we could see, and I think it had happened to any of our pedestrians and fellow road users, right? So today, to guide us on the discussion and to share with us their nuggets of thoughts and information on how we can help in such a situation, we have Dr. Sundar, who's been with me in Nanoxing for the past 5 to 10 years, right? In various capacities. He's now my consultant trauma surgeon. I thank him for really making the time today, because our intended initial guest, Dr. Raj Menon, unfortunately contracted COVID 24 hours or 40 hours before, and I'd like to thank Sundar for kindly stepping in to share with us his thoughts. Thanks,
You're
Sundar.
most welcome. It was an offer I couldn't refuse.
Okay, so instead of handsome Raj, we have handsome Sundar today, right? So, and Kenneth has always been with us, working with the Central Region, really advising us and sharing with us how the paramedic services and our hospital services actually can work as one, as a trauma system, to help our trauma patients within the Central Region of Singapore. So I'd like to thank him and really coming for this session and taking his own time out to give us a hand and share with all of you on a Saturday morning what we can or cannot do, or should not do in such a situation. Right, so without further ado, maybe Sundar, I know you have just been literally thrown into this, right? Just like the patient, the victim just now. Such a dramatic incident, right? If you were to see this on the street, right, how would you now share with a first responder, be it a public, not a first responder like Kenneth? What should we do when we see this? Yeah.
Thankfully, I have not been in this situation, as I hope many of us have not. Although we've seen the aftermath, we've been driving on the roads and we've seen accidents and stuff like that. You've heard it before. I think the first priority is to make sure that there remains only one set of casualties. You and I both have managed a patient who unfortunately resulted from someone trying to help an accident, and then a second accident happens, and that's something that nobody really wants to see. So I think that is the first priority, making sure that yourself trying to help, the people that you're trying to help are all kept safe by diverting traffic, by making sure things are clear as much as you can until more established help arrives. After that, I think the priority, we are trained to realize that, or to stop bleeding first. So if there's obvious bleeding, then just put pressure on it quickly with what you can. The second priority is making sure the airway, which is basically the the flow of air from outside to our lungs, is clear. And in that picture, you could see the patient is lying face down. So I think that part of things, needs to be addressed, which is make sure the airway is clear, while following what we discussed earlier, which is to minimize movement of the head and neck. And that's what I would start off with.
My first response, if I'm a non-medical person, he's flat on his face. What if you ask me to maintain his airway? How do I maintain his airway? Right?
Yeah, I think as a first responder, every bit you do helps. So if I saw a person like that face down in a pool of blood, then I think turning the person over would be good. If there's nothing obstructing, even though the patient is lying on his belly, there's nothing obstructing the nose and mouth, then it may be best to leave them be, as what we talked about before.
Yeah, so I guess if the patient is still breathing, right, and can still groan to you and he's lying face down like that, try not to move him, because he's maintaining his airway, isn't it? Right? And if we turn him, and we may potentially cause more injuries, especially if you are alone. Right? I don't think you should try a maneuver to turn the patient on your own, right? Much as we've seen it on in movies and stuff like that, that does not cut it in this scenario, right? So basically get more help in that sense, right? And what will happen if, I mean, if we need to turn him, right, or turn the victim, how do we enlist other people's help? Maybe Kenneth can share with us.
Again, I think for any population, whether it's a pediatric or adult, we have spoken previously, right? The principle of actually doing spinal maneuvers, right, is actually to minimize the movement of the head. Or if you need to turn, the head and the body needs to move as a whole, right? So that this will minimize any further damage to your spine. So at minimal, it's actually a 2-person procedure. Yeah. However, I mean, in really dire situation, let's say the guy is not breathing, or you see a stab wound that's somewhere that you know you need to quickly turn to actually stop the bleeding or have pressure onto it. Unfortunately, those are situations whereby we have no choice but to turn. But as much as possible, right? Whoever you are, whether the member of public, healthcare profession, right, even myself, we just need to keep in mind, if we can, we need to move as a whole. It's a 2-person procedure, but if really there's a life-threatening injury that I need to do immediately and I have no choice, then by all means we have to turn, like what Dr. Sundar actually rightfully mentioned. We have no choice, because if you don't stop the bleeding, the patient will die from bleeding instead of the spinal injuries. Yeah, so those are the considerations for anyone.
Maybe I'll chip in. Yeah, one point which was brought up earlier, I thought was really good, was there's a lot of uncertainty of should I do this, should I do that. A lot of this uncertainty can be reduced by calling for help. So just flag anyone around nearby, and have at least one of either you or whoever you've got to help to call the 995 hotline, and then you have someone who's removed from the situation guiding you, someone who can give advice on what to do next.
Yeah, so I guess we shouldn't just slow down, look at the accident and drive off and try to get the vehicular number so that we can go for the next lottery, isn't it? We should actually stop and give everybody a hand if we can. But again, stop safely, right? We don't want people to jam up the lanes and park your cars in a very dangerous manner, right? So again, safety, right? Safety around the patient, safety around yourself, right? I think one of the things I learned from Kenneth was the way the ambulances actually stop to provide protection for the victim and the first responders. It's interesting. So we can either, if you see it way ahead, you can stop your car at the distance away from the patient to add a little bit of perimeter around the patient, right? But of course, please be very safe. Put on the hazard lights and make sure that you're very visible, especially if it happens at night. You don't want to be the next victim per se, right? So, by taking on the bleeding portion, right? We saw that there was blood on the pectoral, right? We could, and I think we have to also be very mindful that when a patient or a victim gets hit by a vehicle, right, there will be blood, and this blood can either come from internal bleeding out, or it could be due to foreign objects that, like in some of the cases where it can be impaled by either glass shards or metal from the vehicle. So Sundar and Kenneth, how as a first responder should I now, if I see blood coming from parts of a patient, what do you want me to do? How can I help the patient?
Maybe I'll start off. To our doctors in training and young doctors, we always say that when a patient comes in with an impaled object, it is not a good idea to try and yank it out. If it is an open wound that's bleeding, just put pressure on it. If it is an impaled object, just use whatever you can to minimize movement of that object, and don't try to take it out until help arrives.
On that part, right, just to touch on again on Dr. Sundar's what you've mentioned, I think surprisingly, right, the impaled object is actually the one that's stopping the bleeding. Yeah, so surprisingly, yes, it may looks very severe or very worrisome, yeah, but surprisingly, that is actually the object that actually tamponades the bleeding for more blood from coming out. So that's why, like what Dr. Sundar has rightfully mentioned, right, you actually support that impaled object. For whatever means, towels or blankets or whatever you can find, just to support and stabilize that impaled object, and just bring it together. Because how it's going to be removed, right? Correct me if I'm wrong. It's not even in emergency department. It's going to be removed in the operating theatre. So with that traveling time from the scene in the ambulance or by whatever means of transportation to the emergency department and all the way up to the operating theatre, right? There will be movement. So I guess how, as a first responder, you tie and to stabilize that immobilizing that impaled object, right, actually do help the trauma surgeons. to actually properly to prevent more injuries or prevent more bleedings from actually coming out. So I think that is the main principle of how we actually manage any impaled object.
Thanks for bringing that up. Since we are here and since it was Dr. Teo who taught me this many years ago, I will just share a little bit of why that's the case. Because there are several steps in assessing the patient and preparing the patient before we remove. Before we remove an object from a place where it's impaled, we have to think about where the blood flow into that is, that's the arteries, where the blood flow out from that place is the veins. So without having that control, if you just take it out and you just get bleeding, it's very difficult for anyone, even one of us, whoever our most senior surgeons, it will be very difficult to deal with that situation. And that's the reason why you leave it there, leave it, blocked off or pressed as much as you can, and then we will take care of it once we sort of can.
I guess the take-home message for that, for any impalement itself, right, is to essentially not remove the object, right? And sometimes the object can make things a bit worse, right, and make it, although you see blood coming out from around it, imagine if you were to pull it out, essentially it would be like watching Happy Tree Friends, things spurting out all the time, isn't it? So, but what if the thing gets dislodged, right? And it's not uncommon, right? Same thing with Dr. Hing's cycling group. Sometimes we get spokes of bicycles being impaled into the thigh, calf, and even sometimes worst case scenario into the abdomen and chest, right? What do we do if it gets dislodged? What would you advise? I mean, it's quite dramatic, isn't it, right? So as a first responder, what should we do on the ground?
I think with any other part, whether it's an open wound or whether it was something in the wound which then got dislodged, the safest thing to do would be to put pressure on it. Now that applies to almost every situation except things that would block the mouth, the mouth and the nose basically. You want to make sure that's left free. You can put pressure on almost anything else. The neck is a bit of a special area. You can put pressure on one side of the neck, but obviously don't put pressure on both sides of the neck, or the bleeding will stop, but not in a way that you want.
Okay, so I guess, but what could we can use anything, right, in terms of a towel, a shirt, or anything?
Yeah, whatever. I mean, as a first responder before the ambulance arrive, whether you are a member of public or you happen to be a medical profession, if you don't have any equipment, I think the main principles is just to apply pressure. That's always the first thing. Additional things that you can do, I think in research has also proven that if in an event that the bleeding is so severe, you can actually tie a tourniquet. I mean, the idea is just to actually reduce the blood circulation to that limb or that particular area. I guess you only can tie that to your hands and your legs and not to the body. Yeah. So I mean, if that happens, let's say if it's the body that has that wound, I guess it's only direct pressure that you can do. However, it's at the limbs, you can actually consider if you have already tried putting multiple blankets or towels on it and it's still bleeding severely. Especially if you actually cut the artery, right? You actually maybe tie a tourniquet that's around it just to stop the bleeding. It's not to stop the pulse, it's just to stop the bleeding. Then just wait for the first responder to come. Again, on the philosophy that every drop of blood actually counts for that patient or the victim. So research has actually proven that tourniquet do help in stopping any major bleedings, especially in the limbs.
Okay, I think while we are waiting for the questions to come in, and we have had questions over the last week from the previous sessions that we've had. One of the questions was, number one, to the layman, what is a tourniquet? That's one. Number two, what can I use as a tourniquet? I mean, I have a vague impression of during the 1980s, that shows how old I am, right? When we watch Rambo and stuff like that, they take off their belt and you do dramatic things. What would you share with us could be used in a life hack as a tourniquet?
Anything that actually can just go around that particular limbs is actually fine. So I think in SCDF, I mean locally, when they actually do those public engagement, right, one of the advocate that actually they will advocate to the member of public is actually just take out your belts to actually go around it, or anything that you can tie to actually exert pressure to actually stop the circulation. I won't say stop, just to minimize the circulation to the particular limb. That will actually help. I mean, in times of, let's say, war, or let's say, no, not war, maybe in time of, emergencies, usually you don't have those items there with you. I guess it's only whatever you have on you, example, belt, or maybe a chain that will actually help to, reduce that circulation to the particular limb. That will actually help, actually.
So if we see a deformed limb, right? I mean, it's not uncommon, right? As a pedestrian, I get hit. If I see a deformed limb, right? Other than not moving the patient, but if the patient is in that position, what should I do with that deformity? Do I leave it alone? Do I try to do something to it? What would you advise us to do?
I think it is not a good idea to try to correct deformities and things like that, because you out there would have no way of knowing what the bone shape or the vessel shapes are inside there. I think probably the best thing to do, and the thing that would help the patient feel better, would be to immobilize it as much as possible. It's the movement that causes the pain. It's the movement that causes bleeding or problems inside. So just immobilize it in whatever way you can with whatever rigid objects you have.
I think something that I mean, again, what SCDF, when they do their public engagement, right, again, just put it as per patient's comfort position. I mean, if you have means to actually, maybe you have bandages at scene or towels, long towels to actually immobilize the limb. One very easy splint, or one very common splint that we all have, right, is our body. Yeah, because when you're injured, right, you won't tend to move, right? So you tend to want to just leave it there as it is. So usually what we advocate is, if you have something to tie, just tie the limb to the body itself. All right, that is your natural splint, and actually you minimize movement lah. But I mean, end of the day, you don't have to be so worried about the fracture, because end of the day, I think it's not the fracture that kills any patient. It's still the blood loss and the severe bleeding that actually kills the patient lah. So not to worry so much, I would say. That's more, I would say, more focus on rectifying or finding out whether there's actually major bleedings on the body.
So I guess immobilizing the cervical spine would be the same principle, isn't it? Just making sure that the patient doesn't move. We can use towels to hold the head together or whatever there is, right? Even a bag.
Yeah, I think any object that's reasonably comfortable to have against the side of your head, one on each side, even a pair of shoes or whatever stuff you can get would probably be good for that purpose. I think that reminds me of something something Kenneth said, that the limb injuries tend to be very dramatic, or you see a deformed limb or you see a bleeding limb. But it's important to remember that the important stuff in our body is all in the middle, the head and the trunk. So that's the reason why when we deal with injured patients, we prioritize those injuries over the obvious ones. The patient's head injuries, the patient's injuries to the tummy or the chest, those are the ones that are significant. And in choosing who to help, I think do bear that in mind. If there are more than one victim, look not just at the guy who's screaming, because the person who's not screaming may be equally or worse off. But those things are all really, you need help, and the most important lesson, I think, is to call for help so that you can have help available to help them.
So I guess when there are multiple victims, the one that is sometimes not moving and not screaming, wanting to sue everybody, right, is probably that's the one that you better go to, right, first, right? So, but nonetheless, I think one of the, in my discussions with engagements with the public, right, one of the questions, burning questions they have is, how do I now guide the SCDF or our local paramedics, right, to where I'm injured? I mean, I might be injured along the BKE, or for those who are overseas, from our overseas is one of our expressways, right? The expressway is very long, right? And how will you get to us? Would I have caused a jam if I were to stop to help? Yeah.
I mean, I mean, as best as possible, if you can stop and help. But I guess I can't detect all the scenarios that will happen, because you could be in the middle of a freeway or expressway that is just trees that's around you. Yeah. So especially with in Singapore you have PIE, yeah, whereby you have a portion of it is all just trees. That's all. Yeah. So if you can remember the last exit or the exit that you're going to exit out soon, then that would be good. I guess the next best one is still a lamppost number, to actually remember it. However, I guess there's still, like what we have previously mentioned during the Prof. Tam's section, was that there are also applications that could actually aid you in actually locating where the scene is. So locally in Singapore, we have My Responder app. All right, and that app will actually allow you to actually, it's actually linked to your GPS on your phone or your mobile devices, so you actually can tell us where you are. So I guess if you don't have that in your own local jurisdiction or your own countries, then I guess having proper landmark is actually the best means of actually locating where the scene is. Yeah, and I guess if it's always good also if you don't have, just keep in close communications with the local emergency service operator or the paramedics. I mean, locally, like I mentioned just now, as a paramedic, we need to call the caller to actually verify the location and always keep in close contact with them, just in case if you have passed it or maybe we are not very sure where the location is. It's not within our area of jurisdiction.
Yeah, so I guess in our times of urgency and crisis, sometimes we will get a bit emotional, right? And where I've had to go through some feedback from public that, oh no, they will ask too many questions and stuff like that. So I think these questions are important. I think these questions help us get to you faster. So please be patient with our your local paramedic and first responder provider, because they are trying very hard to be as accurate as they can be. We do understand the emotional anxieties that come with the situation, but we ask for help with that, right? The guy on the other line is desperately trying to help you too, right? But one of the questions that also came in is not so much as a pedestrian being hit by a vehicle. What if I've attended to the pedestrian, right, and the pedestrian seems fine, but the occupants of the vehicle seem to be in trouble? And one of the questions from our participants is that, what do I do if he's in a weird angle, and what would the paramedics advise us to do if I don't want to cause more harm? Maybe Sundar and Kenneth can weigh in together on this.
This sounds like a very high level question. I think apart from the obvious dangers we've talked about of another vehicle coming and hitting people trying to respond, I think there are some dangers to the damaged, collided vehicle itself, which maybe Kenneth can share first before we tackle the second part, the person inside.
Yeah, so I mean, not to touch the patient, I would beg to differ that, because again, if you don't go in and see the patient or you see the victim, right, you won't know whether there's bleeding or not. And it's not right for us to not touch the patient when the patient is actually severely bleeding, because you don't need to be a professor or you don't need to be a medical doctor. I mean, just a layman can actually just help save any traumatic injured patient just by putting on a direct pressure or just putting on a blanket or whatever it is to stop the bleeding. That could actually save the patient's life. You may not know, because it will take time for us to reach, and you may take time for the patient to be extricated out to go to the hospital, depending on where you are. In Singapore, fortunately, our hospitals are all quite nearby. But if you are in a very big, large country, then it will be very difficult, because time is of an essence for any traumatic patients. So I will beg to differ the part that you don't touch the patient. Just look through to see whether is there any severe bleedings. I mean, if no, then just don't touch the patient. That's where you don't touch the patient. Just leave it there and just wait for the responder to come.
To tackle the part about the patient being at a weird angle or parts of them deformed, I think in our criteria for severely injured patients that we need to respond to quickly at the emergency department, one of the criteria is actually prolonged entrapment in a vehicle. And the reason is that that situation tells us that this was a complex. I mean, number one, there was a lot of force involved. It needs a lot of force to deform the vehicle. Number two, the patient may have suffered additional things like exposure to heat and things like that. So those are tricky situations for anyone, even for the first responders. So I think while it may, I think Kenneth is absolutely right that if there's obvious bleeding or if there's something that you can do to help the situation straight away, help. But in a patient who's trapped in a vehicle, it is unlikely that a passerby would have the equipment or the expertise to deal with that, and therefore I think still, maintain a respectful distance. There was a fairly high-profile case a few years ago about a high-speed car crash, and then the car burst into flames, and there was somebody who tried to go in and help, and then the person who was trying to help suffered significant burns herself. So I think those are all things to bear in mind when it's a vehicle that's deformed or obviously, leaking fluid, fire nearby, stuff like that.
Yeah, I think it's very important to emphasize, right, that whilst we are very concerned for the victims of the crash, we do need to ensure safety of ourselves as we go in to respond to them, right? You don't want to be in a situation where you yourself are in danger and become a liability to the whole situation and become one of the casualties. And one of the defensive driving courses that I attended, if we have multiple crashes or the first thing to do when you're running to the vehicle is to actually make sure that the vehicle is turned off, right? Especially when there is engine oil or petroleum being leaking out, or in a smoking vehicle. First and foremost, to turn off the engine rather than go to the patient, because that can cause further burns and injury. And in the Good Samaritans Act that we have enforced in Singapore, right, if you are needed to extract a patient out of the vehicle because he is in imminent danger, right, that is covered in that sense, although we are always very worried about causing more harm to the individual, isn't it? But if we were to leave him there, like Kenneth said, we leave him there, he's going to be in greater danger of potentially exploding car. You do need to now remove the patient. And if in that case we potentially lead to more injuries, the Good Samaritan Act will come in and give us a hand. Of course, I'm not encouraging all of you, right, to rush to the next vehicle and get it down. Ken? Right. So I think it's an important question that triggered a very robust discussion on what to do. I'm told that unfortunately we don't have much time left, right, for today's session. I'm sure there will be other burning questions that you and I have some that I'll ask Sundar and Kenneth along the way. But nonetheless, let's look at the incident that happened again and see what we can, maybe with what Kenneth and Sundar have shared with us, we can now recap what we could have done better and what we should have done. Over to the clip, please.
Hello? 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 SDF? I think I hit somebody. Can you come now? This person is not moving on the road. Where am I? I don't know. Okay. Can you know where? Okay, can. Okay, bye. Oh, she's quite deformed. And she's not conscious. Auntie 听到我讲话吗 Can you hear me? Hello? Okay, I better don't anyhow move. Looks like she's quite badly injured. Oh no. Okay, I just put some pressure.
Well, we have seen what we could have done and what we could have done to help, and I'm very happy to know that that first responder who had my first responder app on, and therefore you could triangulate where she was. So no need to find out. No need to stay there.
I mean, not to sell, but I mean, it's always good if you are local. I mean, you are Singaporean. It's always good for you to download My Responder app from SCDF. At least those are things that will let you know where the location is. I mean, for the responder, and I think it will also help you to actually tell you where the nearest AED or the first aid kit is, so that in the event you need to retrieve those items, right? The app will actually help you to locate those items as well.
Yeah, and one of the things to know that don't move the patient, right? No matter how deformed or mangled, and you could see our first responder focusing on just compressing on the head wound. And remember, head wounds bleed quite a bit, right? And just compressing on it just does help, the gentle pressure, right? Thank you all of you for joining us for today's session. Before we end, any last comments from Sundar and Kenneth?
Well, thank you for having me here. Yes, here.
Okay, so I think I'm very grateful for Sundar to step forward to give us a hand and share with all our public the insights. I know some of you have not. There are many people who may have liked to attend this but didn't have the time, and those who have attended, I will ask you to be our ambassadors to spread the word, right? And help us spread the word of what can be safe and what cannot be safe for the first responders in future, right? And thank you for all your comments on how we can improve on reaching out to the public. Once again, it is our belief that managing trauma is a whole of our system and public engagement, and hopefully not just to prevent them, but how do we equip you as our first responders with the ability to help us ensure that the patient has a better outcome. And that's where the focus of the Central Region Trauma Services in Singapore is going to embark on moving forward. I look forward to engaging all of you, right, for our next World Trauma Day series of events next year, right? And I would love to hear from all of you how you think we as a group can reach out to you to be more meaningful in our engagement and partner all of you in improving care for the trauma patients in Singapore, right? So please fill out the feedback forms, right? There are some prizes to be won, right? If you answer some of the questions that correctly, $10 Decathlon vouchers, you can use it to buy the helmet that Dr. Hing was mentioning about, all right? But nonetheless, right, have a good weekend, right? Stay safe. Remember what Kenneth and our panelists have shared with you on how to stay safe, and I hope to see you guys soon at the next World Trauma Day, but not in my emergency department, right? So take care, guys. Have a good weekend. Thank you.